Now I'm going to turn it back to my close friend, Teresa, who I've really, worked and collaborated with on for the last year and a half. And we're very excited, Teresa, for our next installment in this series tonight. So Teresa, please take it away. Thank you.
Sure. Thank you so much, Jim. And welcome back, everyone. This is the third part of the wild world of management. I have to make sure I don't trip all over that. If you missed the first two, one was the last one was me talking about difficult patient conversations. And then Lynn Leggett was talking about how to transition from admin to manager. And those can be found on CareStack's site, or hit us up in the chat and we'll send you links. Really, really good information there. So when I talked to Rick, if you want to go forward one more slide, when Jim and I were talking and he said, who else are your superstar friends can you bring on? And I thought, oh, well, I got to have Rick on, because Rick always has a ton of questions from people in his Facebook group, which is one of my favorite Facebook groups. It's the Dental Billing Academy. I know that that's not the exact title, but if you search for that, you'll find it on there. Rick Garofalo is the owner of the Dental Practice Mechanics, and he is the main practice mechanic. He has an answer all the time for things. And if he doesn't have an answer, he's going to find it for you. He's a tremendous resource for me, a tremendous resource for many of the manager friends that I have. And I hope that you enjoy this one. This is full of all sorts of gotcha stuff you don't know and things that you need to be aware of. I had a sneak peek at the slides and I'm already ready to take notes, because this stuff takes me by surprise as well. Rick, I'm so happy to welcome you to the program. Thank you so much, and take it away.
Absolutely. Well, thank you very much. You're a big resource too for everybody. So I appreciate you being in the group and helping out where you can. Seems we always have the same answers. We have them copy and paste in and we're 2 or 3 seconds off, but I appreciate it. But anyway, so that's what we want to talk about tonight. Like Teresa said, is talk about the things that people don't know. The new rules that are coming out that are either in effect or are coming into effect that we often overlook, or we hear incorrect information. The main problem with social media, with Facebook, is everybody's suddenly an expert. And, we hear so many times conflicting information. So I'm a big believer in, here's the rule, here's where it says it's the rule, here's what the rule says, and that's what we got to follow. And, my goal is to let everybody know what the rules actually are. So we're going to start with what has been, I'll say, the big thing of the year. And so far, up until about a month ago, that was the 21st Century Cures Act. Now, this is not to be confused with the CARES Act, because the CARES Act had to do with COVID economic recovery. The Cures Act has to do with patients' access to records. And that has become a huge topic lately. And, I don't want people to freak out or get excited or overstress it, because this isn't that big of a deal. Nothing we're really going to talk about is. It's just maybe a little different than the way you're doing things now. So the 21st Century Cures Act is actually divided into 2 parts. There's the access portion, and then there's the information blocking portion. So, one of the things that I want everybody to be aware of when it comes to the Cures Act is the Cures Act applies to electronic records that are part of an EHR, a certified EHR. So I'm actually not sure, Jim, if CareStack is a certified EHR or not. But if your records are in a certified EHR, that information has to be available to those patients. But if your records are not, you have them in a software, or they're still paper and they are not electronic, or your software is not a certified EHR, you don't have to comply with one part of this, which we'll get to in a minute. But the first part of it is about information blocking. and that is blocking the patient's access to their records. Now, we all know that HIPAA requires that we grant access to patients to their records. Under HIPAA law, federal law, we have 30 days when a patient requests a copy of their record. But the new information blocking rule actually says your records are electronic. You are to release them as soon as possible. And so they've kind of overruled the HIPAA 30-day rule by saying it's as soon as possible. And if you get a complaint, because HIPAA is managed by the Office of Civil Rights, by the OCR. The Cures Act is being enforced and managed by the ONC. So they're both part of the Department of Health and Human Services federally, just kind of two subdivisions. And, I always tell people the ONC makes the OCR look like a fluffy little poodle, and ONC is the big bad pit bull now. So if you thought, OCR was tough with HIPAA enforcement, ONC is 10 times worse. They're the big bad pit bull. So you have to be able to explain, if you don't release records in a timely manner, why you did not. And they don't want to hear only one person has an encrypted email box and she was out sick for a week. That's not going to fly. Again, so there's kind of conflicting rules between two federal rules, regulations. And when that happens, you have to follow the stricter of the two rules. Now, in this scenario, when we're talking about patients in access to their records, the stricter means what gives the patient more or faster access to their record, because it's all about the patient. It's all about their access, their continuation of care. A lot of people don't realize since 2013, you actually have not needed a patient's consent to send a copy of their records to another dental office, to another physician who's requesting that information. You don't have to have the patient's consent for that. So the offices that say, well, you have to have HIPAA law says you need a signed release to send records to another dental office, you don't. You haven't since 2013. We're coming up on, it'll be 9 years, and that rule hasn't existed for 9 years. You don't need their consent. So, it's all about expediting that. The other thing to think about when we talk about patients' records and blocking that information is what is part of their record. And a lot of offices think it's simply their last set of x-rays, their last set of bite wings. And what I can tell you is it's not. Their complete records include not only all x-rays, but perio charting, clinical notes, the ledger, billing records, copies of claim forms. There's a lot more to it. Treatment plans, whether they were accepted or not, there's a lot more to it than just the patient's last set of x-rays.
Hey, Rick, can I interrupt for 1 second? We're getting a lot of questions about, we're getting questions in the chat feature, which is great. I want to let the audience know that we have 10 minutes allocated at the end. So if you want to put your questions in the Q&A field, we'll make sure that we address them there. That's the best place to put them. And the second thing is, Rick, are you okay if I launch the poll just so we know who our audience is tonight?
Oh,
is that
absolutely.
Okay, so please go ahead. This is anonymous. We just want to have an idea of who's representing our audience tonight, so we can make sure that we tailor the program specifically. So I'm going to leave that up for about 2 minutes or so.
Absolutely. So anyway, there's a lot more included in the patient's records than just their last set of bite wings. And you have to send what was requested. So if another office contacts you and says, we want copies of their clinical notes, we want copies of their chart notes, we want a copy of their ledger, don't get upset. It's part of the patient's record. They're allowed to have that. And I get a lot of offices that will say, well, why does another office need that? if you've ever had a claim denied because you don't know the date of placement on a crown that was previously placed, that's one reason to have it. And that's just one out of 100 different reasons. So it is convenient to have a lot of those past records. But the information blocking part of the Cures Act is about releasing that information as soon as possible. If the patient owes you $1,000, it doesn't matter. If the patient came in on a special that you ran and got a free FMX and then they never came back again, it doesn't matter if you charged them or not. Once you take those images, once you capture those x-rays, they are part of the patient's record and you have to release them. Whether they've paid for them, whether they haven't paid for them, it doesn't matter. They have to be released. You cannot block the patient's information to their records.
All right, let's do Jim, you want to share the
Yeah, I'll share the results.
real quick?
Yes. Yes. And by the way, I am the final arbiter of the polls, so no one can question my ability as arbiter here. Okay, so overwhelmingly, 75% of our audience is in the manager or administrative function. So that's great to see here tonight. And then really kind of equally distributed between clinical team member, dentist, consultant. And I apologize. I don't know what I meant by office there. I meant to say other. So my mistake there. But for those of you who figured out you're in the office, great. Thank you. Appreciate it. So that's kind of our audience is, 3 out of every 4 people represent the manager or the administrative function.
Absolutely. Well, that's good because they really are I'll say the initial part of any decision-making process and probably a huge part of it. So that's a good thing that they're here learning, because that's the first step, is learning what you need to do to manage your office and then taking it back and instilling those new requirements, those new rules. So, that's a good thing. I'm glad to see everybody here. So, after the information blocking part of the Cures Act is electronic access. And this is really, really simple. If you think about it, most healthcare providers already have this. I know, me locally, I live outside of Philadelphia. Our big medical group here that owns all 7 of the hospitals and 99% of all of the doctor's offices and specialist offices, they have an app, they have a web portal that I can go to, and literally an hour after I leave a doctor's appointment, my chart note is on my phone and I can look at the clinical chart note from that doctor's appointment an hour after I'm there. I can actually look at x-rays, I can look at images, I can look at CT reports, I can look at all of that. And that's what this is about. Most other healthcare settings already have this. You go to, a Quest blood lab or anything like that. You can log onto their website or log onto their app and not only make appointments, but you can also access your records, your test results through that portal. That's all this is giving patients that electronic access so that they can access their records anytime they want. So, again, remember, this whole rule is purely about giving patients quicker access to their records. Now, the app, the web portal part of it, again, this only applies if your records are kept in a certified EHR. If they're not, you don't have to, oh no, my company's not a certified EHR, I have to find a new software. That's not the case. You don't have to find a new software. This part of the rule doesn't apply to you because your software is not a certified EHR. So if it is, this applies. I will tell you, a lot of the softwares out there are certified EHRs because they got it done a couple of years ago for meaningful use, for the dentist to get all those 20, 30, 40, $60,000 payments in for meaningful use if you qualified for it. They became certified EHRs, and now it applies to those. But again, this isn't something a dental office has to worry about right now. We have, a number of months until this even becomes a thing, and all of the software companies that have to do this are already either working on or have app access to those records. So not something to stress about, not something to worry about. There's nothing you need to do for this right now other than be prepared. That's all you have to do. And when I say be prepared, here's what I mean. If you're going to be providing online web portal or app access to your patients, to your clinical notes, stop writing in your clinical notes, patient is a PITA, because everybody knows what that means. Everybody knows what that means now. When we put in a clinical note, patient is a VIP. I don't know if people still do that. 10 years ago, we used to do that in chart notes. Patient is a VIP. 10, 12 years ago, that was our way of saying, she's a Karen. But everybody knows what that means now. So you have to be very, very careful if this is going to apply to you, what you're putting in your chart notes, and very, very careful about what you're scanning into their images, into their smart docs, into their document center, into their document storage, whatever it may be in your software. We have to be careful about that because they're going to have access to that. And bulk EOBs with 25 other patients' names and information on them is not going to be a good thing as far as HIPAA privacy goes when you have a bulk EOB scanned in and all 26 patients can see all 25 of the other patients' information on there. So be ready, but don't overstress it right now. That's the important thing. So that's the Cures Act. That was the big thing. That was the big topic of conversation up until the No Surprise Billing Act kicked in and really became publicized a few weeks ago. And that happened because we're getting close to the deadline. So, there has been a lot of confusion about this. There has been a lot of released statements of, don't worry about it, it won't apply, it will apply, we don't know if it will apply. And, number one, the big thing you have to remember is, and this is actually, Teresa sent me this little blurb, which I appreciated because it saved me from reading through 500 pages worth of rules. And it says right in the definition, right in the actual law, it includes items or services such as those related to dental health. I have read the majority of the law at this point. I've talked to a few directors at the Department of Health and Human Services. I have spoken to attorneys. I know other people who have spoken to attorneys, and they've all said there is absolutely nothing in here that excludes dentistry. More so, there are items such as this one that's highlighted in yellow that actually says it includes services related to dentistry. But, now here's what this No Surprise Billing Act means. I don't know if this has ever happened to any of you. I know it's happened to Teresa. I know it happened to me last year in August of 2020. I had a pulmonary embolism. I had a blood clot in my lung, was rushed to the hospital. The hospital is owned by the health group around here that owns all of them. But one of the doctors who saw me in the emergency room was not in network. The hospital was in network. All the other doctors were in network, but one doctor who treated me in the ER was not in network. I got a $1,600 bill that was from the hospital for my health insurance copay. And then I got an $84,000 bill from the out of network provider who treated me in the ER for 3 hours. They were out of network. My health insurance, paid the minimal amount that they paid towards that treatment. And because that provider was out of network, I was responsible to pay their balance, all of their charges in full. I was unconscious. I couldn't sign anything. I couldn't agree to see him if he was out of network. And it was an emergency situation. That's what this bill was intended to stop. It was intended to stop going to an in-network place where you think you're going to be covered,
Right.
and then finding out one of the 15 doctors that treated you or the one lab that did blood work was not in network. And now you have a $20,000 bill for, one blood draw worth of lab work because they're out of network when the whole rest of the hospital or rest of the facility is in. So they created this law to prevent that. But, and for good reason. A lot of people don't realize 80% of the bankruptcies filed in the United States every year are due to medical bills because of surprise medical bills. You have health insurance. You think, hey, I pay my $900 a month premium for my health insurance. I go to a hospital that's in network. And guess what? Now I saw one out of network provider. I have an $80,000 bill. And, a lot of people, you'd have no choice but to file bankruptcy or make a $50 or $100 a month payment for the rest of your life. And that's why this bill was out there. But there is nothing in the bill that I can find, that attorneys can find, or that directors at Department of Health and Human Services can find that excludes dentistry. It's there. Now, here's what I'll tell you. Again, this is absolutely not anything to freak out about. If you are in network, you are out of network, all you have to do is tell people. You just have to be honest. So, this is something we should have been doing all along. Compliance with this part of the No Surprise Act is very, very simple. Have one line on the bottom of your treatment plan that says, we are an out-of-network facility and you are responsible for up to the full fee listed above. Bam, you're done, you're good, you're covered. There's nothing else for you to stress or worry about. You're done. It's good. We should be doing that anyway. And I'll be honest with you, the only people that this bothers are the people who are purposely deceptive about their network status with patients. The patients who call and the office says, oh, we absolutely work with your insurance. Come on in, we'll get you taken care of, knowing you're out of network. And I see a lot of people every day in these Facebook groups say, how do you handle when you're out of network and a patient calls? We absolutely work with your insurance. Come on in. Well, they didn't specifically ask if we're in or out of network, and we'll submit their claim for them. We work with their insurance. That is very, very blurry line deceptive. So, this is now in place to ensure that doesn't happen anymore. It's a very important thing for a lot of people, considering, again, the vast majority of bankruptcies in the United States are caused by medical bills. The other thing you have to remember, 70% of the population of the United States does not have $500 in the bank in savings. So what that means is, when they walk into your office and you tell them, yeah, you need a crown, your copay is going to be $650. That $650 copay is emptying their bank account. It's taking the money they have down to zero. So, it means more to a lot of people. And, this is something we have to remember. is, we're not asking them to make a decision between get a crown or get a triple bypass. We're asking them to make a decision between get that root canal or buy groceries and pay your electric bill this month. So, we really, really, really should be always upfront with our pricing anyway. Now we just have to. Now, the other thing to remember when it comes to the No Surprise Billing Act is good faith estimates are required of all licensed healthcare providers in the United States. Absolutely required. And a lot of people are missing this. There is an official notification, and the link is there. Take a screenshot of it. It's a long one to type in. I will post it in the chat as well. So that will be there. But there is a notification, a very specific form that you have to have hung as of January 1st, 2022 in a public area in your office for all to see, that tells them you will provide a good faith estimate of all services that are going to be performed on those patients. So a lot of people say, well, we always give a treatment plan unless it's for a limited exam and a PA. We just tell them over the phone, yeah, it's going to be $70 or, oh, it'll be, you can't do that anymore, because under the good faith estimate rule, if you don't provide a good faith estimate, they don't have to pay you. And there is an entire part of the Department of Health and Human Services. Actually, my company is going through the certification process now to be an arbitrator for the No Surprise Billing Act. So when a patient has an issue with an insurance company, or an insurance company has an issue with a provider, or a patient has an issue with a provider, and that provider has not followed these requirements, it's going to be the arbitrators who the provider has to pay anywhere from $200 to $500, depending on the case, to handle the complaint, investigate it, and make a ruling. And I'm telling you, as we're going through that certification process, it is very, very heavily leaning towards the side of the patient. If you didn't have them sign something, the provider loses, the patient wins and doesn't pay you. If you don't have this hung in a public area, if you didn't bring it to their attention, they win, you immediately lose. So, this is a very patient-friendly act. But that notification is required of all licensed providers, no matter what. And the notification poster, which is on that website, it's actually a link to a zip file that you'll be able to download that has the rules, the requirements, a copy of the poster. There's a number of things on there, and it's right from CMS. It's right from the government. It's not coming from me. It's coming right from the government. And all the information will be right there on that link. Again, I will post a link, that link, in the chat, so it'll be there. You guys can click on it once we get a little later on and we get into the questions, so it'll be closer towards the bottom and not lost in the middle. So that is the No Surprise Billing Act. I know I've talked to a ton of people. Just remember, this isn't a big deal. This is stuff you should have been doing anyway, being upfront, being transparent with your patients, giving them good faith estimates, having them sign treatment plans for care. This is things we should have been doing for the past 20 years. Why we haven't, I don't know. But for those that haven't, it's now catching up, and it's time to start doing it the right way, the way we should have been doing it all along.
Rick, a quick reminder for our attendees tonight, please, the Q&A, there's a lot of comments in chat. We're not going to be able to address them because we're going to be looking in the Q&A. That's going to be the way that we're going to manage this. So if you put something in chat and you want it to be addressed by Rick here, in 15 minutes or so, please put it in the Q&A field. Thank you.
All right, so the next thing that's been a bit of a topic lately has been the OSHA ETS, the Emergency Technical Standard. This was actually a big thing yesterday, because yesterday morning, the Senate announced that the president's 100 plus employee vaccination rule that was set to go into effect is being tossed out. So that was the OSHA General Population ETS, Emergency Technical Standard, that said any employer with 100 or more employees absolutely must require either COVID vaccinations or weekly or sometimes twice a week testing. The Senate threw that out. However, there's a second ETS. There's the healthcare ETS, and the healthcare ETS applies to dental offices. It's a totally separate thing. It does not mandate vaccines. It does not require vaccines. And quite honestly, it doesn't have to apply to your dental office if you follow one simple step. So I have the chart that says, does the healthcare ETS apply to you? Is the workplace a setting where any employee provides healthcare services or healthcare support? Yes, you are. You're a dental office, you absolutely do. Does the workplace meet all of the following conditions? It is a non-hospital ambulatory care setting. It is. By definition, dental offices are non-hospital ambulatory care settings. So yes, we meet that one. Are all non-employees screened prior to entry? This is the one that gets people. If you stopped pre-screening patients, if you stopped asking them, have you traveled out of state, traveled out of the country? Have you, had any symptoms? Have you done all of that? If you've stopped screening, start again, because that one simple step of screening prior to entry, all non-employees. So remember, that doesn't just mean patients. That means anyone that is not an employee of the dental office walking into your facility absolutely must be screened. Sales reps, contractors, the plumber, the HVAC guy, the doctor's spouse who's not an employee, who's coming into the office for lunch. Every non-employee must be screened. And of course, people with suspected or confirmed COVID are not permitted to enter. I'm pretty sure we're all doing that. So if you can answer yes to all three of those questions, the ETS, the Healthcare Emergency Technical Standard, does not apply to your office. If you have stopped screening, dental offices do not meet any of the following. So the only thing that's left is, yes, the ETS applies to your office. And believe me, you do not want the healthcare ETS to apply to your office, because it requires vaccination status of every employee. Non-vaccinated employees are not allowed to remove their mask in the office, even in a break room. There has to be physical distancing. There has to be physical barriers between vaccinated and unvaccinated. It is a whole process that you do not want to apply to your office. So every dental office in the country can very simply not have the ETS apply to them if they just screen all non-employees prior to them walking in the office. Again, patients, patients' guests, patients' parents, patients' kids, sales reps, consultants, everybody walking in the office that is not an employee, they do the pre-screening and you're good. The ETS does not apply to you at all. Very simple. You're opted out. you're exempted, and there is nothing for you to worry about. Now, if you're not doing that, then the entire ETS applies. And like I said, it is a huge headache. It is not something I want applying to any dental office because they're skipping one very simple step. So that brings us on to the next topic, annual training. We were actually talking about this earlier tonight. One thing I want everybody to be aware of, the annual training that both OSHA and HIPAA require are site-specific trainings. Okay, taking an online class or taking a CE at the State Dental Association annual conference does not satisfy the annual training requirements. Your site-specific training has to include things like where your rally point is. So if you're in the middle of a workday and your office catches on fire, where do all of your employees go after they've evacuated the building to meet so they can all be accounted for? That's part of your annual training. That's not something that you're going to be taught at the State Dental Association OSHA conference. That's part of OSHA training. What is your policy on checking personal email? That's part of your HIPAA training. Again, not something that's going to be covered at a big meeting with people from 100 different offices. So that training has to be site specific to your office. Very important and very, very missed. The next thing that I see a lot of people getting caught up on, and I have a pretty large Facebook group, and we get questions about everything. And one of the common questions is, does anybody have a copy of their employee handbook that I can have? And they want to just go through it and change the names and change it from Main Street Dental to Second Avenue Dental, and boom, there's our employee handbook. But you can't do that because there's different laws from state to state, from county to county. I'm in Pennsylvania. We're in Berks County. Berks County, Pennsylvania has no mandatory PTO time, sick time, et cetera, et cetera. If I drive 30 miles into the Philadelphia County or the city and county of Philadelphia, and I'm an employer there, there is mandatory paid sick time. There is mandatory PTO. So even within your own state, there can be incredible differences. So please, please, please don't get caught up in, let me borrow somebody else's handbook, open it in Word, do a quick, find and replace in Microsoft Word and change the name, and here's our new handbook, because it may not be compliant going from, 10 miles down the road to me. So
Thank you for preemptively discussing that, because I know that was going to come up in the Q&A. So,
oh,
and so, Rick, this is your 7-minute warning until we get to the Q&A. So keep going, my
perfect.
man.
We're good. The next thing, again, when it comes to human relations, not to put in your handbook is salary discussion prohibition. Prohibition. You are not allowed to tell employees they can't talk about their salary. Again, I see those questions all the time. I had 2 hygienists. They were talking about their salaries. One's been with me for 10 years. One's been with me for 2. The one there for 10 years makes way more than the one that's been there for 2. I fired them both because you're not allowed to discuss your salary with other employees. They are allowed. The federal government encourages them to do so. And just you having a policy that says you're not allowed to is a violation of the National Labor Relations Act and can get your office in a lot of trouble. So, please, 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 if you have that in your handbook, get rid of it, because it's a big thing. People are learning, people are understanding. There's pushes to unionize, there's pushes to this. And the reason that's all happening is because people don't know these rules. They make a rule. Somebody asks a question in my Facebook group and I tell them your boss isn't allowed to have that in there. And it causes a whole lot of drama. So please, please, please get rid of it. So now we're going to move on to some real quick dental insurance topics, because anytime Teresa and I are together, people expect us to talk about dental insurance. So the new thing this year came from Delta of Arizona, and it is talking about them paying for services or the frequency limitations being changed in 2022 to when you submit something versus when they paid for it. So, real quick, right now, the way it works, if you submit a claim for a crown and the patient has a 5-year replacement rule, 2021, as of right now, you submit the claim for that crown. It's been 4.5 years. Delta will say, we're not paying because they have a 5-year time limit, but thank you for submitting it because you've now reset that 5-year counter. So now we can go 9.5 years, the 4.5 between when it was done last and when you redid it, plus another 5 years because we have the 60-month replacement rule, and we don't have to pay for that crown. It's for FMXs, bite wings, anything with a frequency limitation. What Delta Dental of Arizona is changing to in 2022, and it's a good thing. It's a good thing for you and your patients. What they are changing to is if you have submitted it, it will not reset or change the frequency limitation unless they pay for it. So, think about an FMX. Patient had an FMX done at another office 2 years ago. They come to your office. They have a 36-month frequency limitation. They come to your office. You do an FMX. You submit the claim. Delta says, hey, thanks. Now it's another 3 years. So we can go 5 years without paying for one. Because when you submitted it, you reset that 3-year timer. Even though Delta didn't pay, they made it patient responsibility due to frequency. As of 2022, Delta of Arizona, it's just Arizona right now, so don't everybody get excited. But Delta of Arizona, right now, unless they pay for it, it will not reset the frequency limitation. So it's a great thing. It's a fantastic thing for patients. It's a great thing for offices. I don't know why they're doing it. It's so good for us, but they are, and that's where they're going. So, the last thing I want to talk about is narratives. Okay. One of the big things that has come up, I know Teresa and I have talked about this regularly, is chart notes. Okay, my company, when we do billing for our clients all over the country, the only note that we will use, the only narrative we will use is a chart note, a clinical note. You do not separately write a narrative to be submitted with a claim. Delta Dental said, and this was new in their national provider manual in 2021, but we've been doing it, and I know Teresa has been telling people to do it for years and years and years. Narratives are only your chart notes. So your chart notes have to say not only what you did, but why you did it. So that is super important. And, please, please, please consider going to SOAP notes. Every doctor learned about SOAP notes. I'm sure, everybody knows or should know what a SOAP note is. Please, please, please consider going to SOAP notes, because you're going to see more and more and more insurance companies only accepting clinical notes as narratives. Super important. Something everybody should do. And, I tell everybody, don't write your chart note for you. Don't write it for the insurance company. Write it for the judge and the jury who are going to be reading it 5 years from now. So, every software has an auto note, a quick note, way to shoot your normal SOAP note in there and then fill in the blanks and make changes and customize it for that patient. Use that. It makes things so much easier. So now we're at the
Rick,
end.
phenomenal. Oh, Rick, you're giving away you gotta have your contact information, Rick. You're giving this away. Fast forward, Rick. Come on. There we go.
Oh, somebody said put it before this one.
I know I messed up.
No
All
problem.
right.
That was Teresa, back to you. I know we have 11 questions. I don't think we're going to get to them all, but please, if you want to take them in order, go for it. Any way you want to work them here, please.
Sure. So there's a couple questions about the form that you were referencing. So I'm just going to combine a couple of these. Do you have to display it whether you're out of network? And basically, the other question was, does it apply only for uninsured patients? So out of network and uninsured, or is it everyone?
The good faith estimate applies to everyone.
Okay.
No matter what, in network, out of network, uninsured, it applies to everyone. It is a very consumer friendly part of the act. And, like we were talking about earlier, when you go to the consumer side of the No Surprise Act website, it is very specific. It doesn't say it applies only in hospitals. It applies only here. It says it applies at all healthcare providers in the country. So even if somebody comes out and says to you, listen, if I tell you guys tomorrow, this does not apply, No Surprise doesn't apply to dentists, you don't have to do a thing. Even if I tell you that, you're going to have patients going to that website, seeing their statement that says all healthcare providers.
Yep.
And they're not going to know the difference. And it's going to cause arguments. We argue enough with our patients. We have enough stress in our life as office managers.
It's true.
One simple paper, one simple line at the bottom of a treatment plan, and it all goes away. It's not hard.
All right. Well, what about, so I had a couple questions on even for hygiene appointments, even for cleaning appointments.
Absolutely.
Okay.
It doesn't matter anymore. The actual rule says it is not considered an emergency if it is scheduled more than 3 days in advance. So if the appointment is scheduled more than 3 days in advance, you absolutely have no choice but to have that signed agreement. Okay. It doesn't matter if it's for a recall. It doesn't matter. Because here's the thing. Let's say you're expecting their insurance to pay 100%, but then you get that retroactive termination letter 4 months later. And now the patient says, well, you didn't have me sign anything saying I might owe that money. It's not my problem. My insurance got retroactively terminated. You didn't have me sign it. I don't have to pay you. And they're right. So,
all right. So then let's move back to the EHRs. We had a couple questions on EHRs. First of all, how do you find out if the software is certified, is a certified EHR provider?
Call them and ask them. They'll know. Their website will say it. I mean, if chances are if you go on Google and type in the name of your software and certified EHR, you'll very easily get some pop-up from their website that will say we are or we aren't. Okay. But worst case scenario, give them a call.
So let me see here. So Tiffany, you put in something in the chat, and also, so she's saying she's already asked Dentrix. They are not EHR for anyone that's asking. And then she also asked a question earlier. If let me see, can the office claim, this is about sharing the electronic records, can the office claim it is their policy to have a records release signed?
They can, as long as they're not delaying the release of the record. Okay. If they make that form available to be electronically signed, or even an email from the patient saying I authorize the release of my records to Dr. Smith, that's fine. If they require the patient to fill out a specific form or actually come to the office, that is not okay, because it's information blocking and you're not allowed to do that. But and on a side note, Dentrix is a certified EHR, so I would double check that.
Okay. Okay. No, that's good to know. This is good to know. Coming at you live with all this information. So another anonymous here. We don't have to provide electronic access, or we do by a certain date. What is the date again that needs to happen?
October 21st, 2022.
Okay.
Right now, there's nothing for us to do.
Okay.
We are in a holding pattern waiting for the software developers to develop that. The
Okay.
ones that it applies to, know it applies to them. And, just like everything else, you get 100 different answers from 100 different people, because I've talked to people at Patterson in the compliance department, and they're like, yeah, we know we have to do it. We're working on it. And then I get 15 messages from somebody saying, I talked to our Patterson rep and they said they know nothing about it and they're not doing it.
Yeah.
Yes, they are. But
yeah, I know you have to go to the source on that. Okay, so I'm going to go ahead and answer this one. Can you, because it's an onion question. It's got so many layers. Can you have a patient sign a form or something explaining insurance covers this much and you're responsible for the rest, whether you're in network or out of network? So we talked about that they do need to have a form, but I want to give a shout out to Rick, because his site, if you go to his site, practicemechanic.com, and go to the resources tab, he's actually got a couple different forms there that also may be helpful for you when it comes to making sure that you're being really accurate with the co-payment, or I'm sorry, the co-insurance amount. And now I'm going to pivot into the screening, because we did have a couple of questions on that. But again, I can pretty much combine these because they were very similar. Do the screenings need to be on paper or verbal, first of all?
they have to be documented.
Okay.
So as long as you're documenting they're done, you're good.
What about retaining screening records of non-patients? I'm guessing that's people coming in to assist and stuff. Do you need to do that?
Yes, you do.
Okay.
Every non-employee.
Okay. And then do we actually have to record the temps or the pre-screening anywhere? Can we just put patient pre-screened clear in the clinical notes?
If you're taking the temp, you're a healthcare provider, you gotta document it.
Okay. All right. That's good. Okay. So I did that one. Yeah. See, these were kind of all the same. So if we are screening everyone before they enter the office, do we still need to do COVID weekly testing for unvaccinated employee?
This is going to depend on the state. Per the federal ETS, you do not. However, there are some states, California, Washington, where yes, you absolutely do. If your state is one that has a mandatory vaccination for healthcare workers or the test, yes, you absolutely still have to do that. It just means the federal law doesn't apply, but the more strict state law now does.
And there was another question about, do we still need to do that for employees? And same answer that Rick just gave. You need to go there. And then somebody's asking, do you have to take temps? Two people asked at the same time as part of the screening. Rick?
I have seen conflicting information because some people say temps are not an accurate determining factor. Some people say they certainly can be, and the ADA still has in their screening guideline temp taking. Okay. So as long as it's still part of their guideline, I'm still going to do it. Feelings aside of what works and what doesn't, and what's scientific and what isn't, it's part of their written policy. I'm going to continue to follow it until they change it.
All right. So Debbie is asking about a sample SOAP note. Should we send them to your resources, or should we give a shout out to Andre and his book?
Absolutely. Andre has a ton of them.
Yeah. Andre Chardin runs a book, or I'm sorry, he has a book called The Crew Notes. And I will put that in the chat in just a second. It's fantastic. He's a friend of ours. Somebody is asking, will the webinar be available online for my office manager to watch? Absolutely. Jim's crew is really good on that. And one last question was, if employees are not willing to vaccinate, but putting patients at risk. That's interesting, because I think you're seeing now from everywhere that it's both vaccinated and unvaccinated. So let's just treat everyone the same on that. And then let's see here. We got that one. And then one last one, Rick. What do you say to a patient who refuses screening? What kind of verbiage do you use?
GTFMO. I don't know if you all know what that stands for, but
Wow, that's a mouthful.
I had to like think, did he really say that? But yeah, he did. So
he really did. I
it's part of
really did.
compliance. Yeah, it's
I really did say it. It's not a choice. If you don't want to do it, you need to get out. You need to get out of my office.
Well, Jim, we have gone through all of those questions. Look at
Yeah,
that.
that's impressive. And Rick, can you also drop your Facebook group, how people can join that? Because I know there's going to be interest in how do I stay engaged with you. If you can just add it to the chat, that would be great.
Absolutely.
Teresa and Rick, on behalf of CareStack and Darby, this is such a great program, and we kept everyone engaged here to the end. Rick, if you can rewind your slide too, I'll give you lots of multiple things to do at once, but let's share with everybody because I don't want to get my email to blow up. We want to reward you, everyone here, with a holiday spirit, a $25 Grubhub gift card for you spending your dinner hour with us. So you're going to email AJ at CareStack from the email you used to register for this program. With that code, Rick2021, and your email and mobile number. And probably I would say by the 30th of December, you're going to receive a gift card from CareStack for Grubhub. So at least we put food in your belly, right, Teresa?
That's right.
If nothing else. But Rick, thank you for an amazing program. Teresa, thank you for putting this together. Can you talk about our next event? Just give everyone a heads up on that. And then I'm going to transition and grab this screen here, if that's all right from you, Rick.
Absolutely.
So yes, if you want to save the date for January 25th, same bat time, same bat place. Well, actually a new link, but we'll have my friend Beverly Wilburn will be talking about how to work with your referring offices. She comes from a very successful specialty office. She's perio, and she has lots of tricks for both sides, whether you're general or whether you're a specialist. And she's got, I've watched her grow her practice or keep it growing for years. So I think that's going to be a good one. So January 25th, mark your calendars and look for promo, and we'll definitely be getting a link out to you so that you can register.
Yeah, thank you. And CareStack, we are big about opting in. So please follow us in our champions group, or look and follow Teresa on her Facebook page so you don't get bombarded with emails. That's the best way to find out about our calendar.